I was telling you about, payments above their threshold. That's some $27 million and 9,911,601. Okay, so once you pay beyond your threshold, you've gone contrary to those provisions. You shouldn't have done that. So the Auditor General flags that. Then there's another one here. Okay, this is one of the things that the Auditor General, talks about and says, going forward, you don't have to be engaged in some of these things. So, for instance, he talks about frontline workers' life insurance policy or package, and now talks about general principles of insurance requiring that when an employer or organization purchases group life insurance to cover employees in case of death, accident, temporary disability, and critical illness, the employer organization may keep the master agreement, but the identified employees should receive certificate of coverage, which could be used by the beneficiary or next of kin to apply for the claims when the need arises. But they say they observed that the ministry paid $10 million as premium for special life insurance on COVID-19 without any life insurance policy document detailing the beneficiaries, their location, details of next of kin in case of death, nature of benefit, and the terms of coverage. So while the chief director was explaining that insuring health workers under the pandemic was novel to the ministry and even the insurance industry in Ghana, and hence they did not know which health workers to list and the ones to leave out, and they therefore paid a premium for a blanket number of 10,000 health workers. And they recommend that they should liaise with the Ghana Health Service to identify the health workers and allied professionals to assist the workers to complete the necessary insurance documents, because they are saying that, look, you need these persons. And the Auditor General has raised these concerns because, sometimes dealing with insurance companies will be very difficult if you, leave something behind. And I've been involved in an accident recently, and, when I was taking pictures for my insurance, for my claims, for instance, and the number plate had been mangled, and as a result, they came back and said, well, what is the proof that this is your car? We have seen everything that is written on it. Yes, we know that it is yours. The police have indicated that in a report that it is yours, but unfortunately, we cannot say that this is yours because of the fact that we don't see the car number and would identify cars with their numbers.
Imagine.
Yeah. So that's just that by way of the Auditor General saying, no, we have to do things right here. Then you have medical items not accounted for, amounting to $247,405. So the Auditor General start from, and I started by telling you that, in many of these things, he flags them because they do not go according to provisions of our public financial management laws. So he says Section 96 would indicate that a person connected with the procurement or control of a government stores is responsible for any deficiency in or for the loss. And they observed that medical equipment valued at $247,000 procured and received at the temporary central medical stores and subsequently issued to some specific health facilities between January 2021 and June 2022 were yet to be received by the health facilities at the time of the audit, which was in November.
Hey.
So this is the point. Those medicines have been procured,
Yes.
received at the stores, and issued to some specific health facilities. But at the time of the audit, in November 2022, the health facilities had not received them.
Okay. There was something, I don't know if it's on your list, but there was something about some insurance.
Yeah.
That was purchased for people without any details whatsoever.
That's what I just talked about. The insurance, 10 million cities worth of insurance. And the Auditor General has talked about the fact that, these persons, they should find who these persons are and indicate who the beneficiaries are. So he flags that and says, go ahead and find these persons and indicate who these persons are.
But does that mean that nobody ever made a claim during, the lockdown and the pandemic time?
Well, the Auditor General's report does not capture that. What the Auditor General's report captures basically is that you do not have evidence of the beneficiaries. And he thinks that minus the evidence of beneficiaries, it could become problematic for you. And so go ahead, indicate these persons, because in the Auditor General's report, he talks about the fact that, and he would indicate also how these monies were shared among some insurance companies in Ghana. So, for instance, the Auditor General shows that enterprise life assurances were giving, 30% of those who were insured. SIC Life Company Limited had 20%.
Wait, Enterprise had more than SIC?
Yes, they had more than SIC.
SIC is still state-owned, isn't it?
Yes, and they had 20%. Glyco Life Assurance had 15%. Star Life Assurance had 7.5%. Holland Life Assurance, 5%. Ghana Union Assurance, 5%. My Life Assurance, 5%. GN Life Assurance, 5%. Allianz Life Ghana, 5%. And Ghana Life Insurance, 2.5%. Total money in here is 10,309,919.94 Ghana cedis.
So, Winston, on this insurance thing, just to clarify, I want to test my understanding here. They were insured for a period, were they not?
Well, the Auditor General here does not indicate the period within which they were insured.
So does that mean they could still be enjoying that benefit of insurance?
That's a possibility.
Okay, because this is something that was given to them as a benefit, right? Because they were working on the front line. Am I correct?
Yes.
Okay. So my assumption was that it was for a period, like how they were being paid an extra 50% of their salary for a period. So I assumed that this benefit was also for a period. In which case, if it has passed, if that time has passed, then that insurance no longer applies to them, or they are no longer insured under this scheme. So the question is, while they were insured, were there any collections, were there any claims made? How did they make the claim? If your name is not on the policy, how do you make a claim?
So according to the Auditor General, some 418 health workers have received payments from Enterprise Life.
So how did they pay?
418, because subsequently, when management indicated to them that when they started, they didn't submit the list. Right. Subsequently, they presented a list to some of these insurance companies, out of which 418 of them have received payments. Okay, so that's it from the Auditor General when it comes to the Ministry of Health